Let's say we want to do an exam on our fake patient, Harvey Lillard. I would click on the button that says exam. His picture comes up, his fake DOB comes up. And let's say I wanted to do a select by region exam. For this example, let's pretend that Harvey came in and he's complaining about pain in his low back on the right. He reaches around and touches what looks like his sacroiliac joint. So I'm thinking, all right, could be a right SI, could be a disc herniation if he's got radiculopathy, could be a piriformis syndrome, could just be a subluxated lumbar vertebra on the right. So I would go into lumbar tests to rule out a disc herniation. I might pick the test Valsalva. When I land on it, you'll see a picture of the patient and usually a picture of me performing the test. When I click on it, it's kind of a cheat sheet in that it says this is how the test is performed, and if this test is positive, there'll be an increase in the patient's radicular pain. So I say, Harv, take a deep breath and bear down. Do you feel any radiating pain going down into your right leg? He says no. So the test is within normal limits. Perhaps I then go to straight leg raise. Again, I'm given information about this, and this test is going to be positive if when he brings his chin to his chest, he can't do it because of the pain that he has going down his back and his leg. So I said, is this causing any pain? He goes, it doesn't hurt when I bring my chin to my chest, but I'm aware that when you bring my leg up, there's very tight muscles back there. So I might say that the test is within normal limits. However, there's an incidental finding. And the incidental finding is that he has tight hamstrings. So I might say, however, he has tight hamstrings. And pop that in there. Again, not a positive test, but some good information for us to know. So perhaps I then go to Knockless. Knockless is going to differentially diagnose a sacroiliac problem from a lumbosacral problem. So when I land on it, and again, it reminds me how to do it, I say, does this hurt? He goes, yes, it does, and it hurts right over my right sacroiliac joint. So at this point, I'm thinking to myself, doesn't look like a disc, looks more like a sacroiliac problem. So I don't need to do any more lumbar discs, and I say done. Now I might jump into pelvis and SI tests. At this point, I go to Yeoman's, any test that you want. I push down on the SI, in this case would be the other side. He says, I'm getting pain on the right. So that looks positive. I can pick any other test I want, Hibbs, whatever. And again, pain on the right. So now I'm thinking it looks like an SI test. So I would hit done. If I wanted to do a postural analysis, for example, I might notice that he has anterior translation, maybe a sway back, maybe one ear is lower than the other, maybe one shoulder is lower, maybe he's got a short leg and that on the iliac crest it's low, the hip is low, the knees may be low, maybe he's even pronating bilaterally, and I even have the ability, if I'm using bilateral scales, to put in the weight. Again, if it's appropriate, I can put in neurological testing, all in here, dermatomes. One of the things that's nice is on the dermatomes, I could never remember where they were. So we've made them actually in blue. So you can say, if they're all normal, that's great. If I do muscle strength, it's a quick reminder as to what muscle corresponds to which nerve root. And then I can say, let's say they were all normal. Same thing with reflexes, deep tendon reflexes. It'll tell me which nerve root corresponds to which reflex. Let's say they were all normal. And when I'm done, I can easily say done and finish up my test. If I want to pop in something about his smoking status, I can. Otherwise, I'm at the very end and I can put in diagnosis codes. In this particular case, let's say we wanted to throw in that the guy has sacroiliitis. Obviously, we're using ICD-10 codes. Maybe he's got a sprain of the SI joint. Maybe we want to throw in a subluxation, segmental dysfunction on the SI joint. And I can remove any of the ones perhaps that were there that are inappropriate and then say done. Whenever this began, let's say it was a couple of days ago, and I say done, what I'll have will be a very complete orthopedic exam, in this case orthopedic exam number 2. and it's going to have all the information about him. Any information that I didn't do in this case, such as vitals, I can delete. But all the information that's in there, including the orthopedic tests that were normal, the ones that were positive, what it meant that they were positive, all that information goes in. And then at the end, it's going to sign my name, print my name, have the date that I signed it, my NPI, etc. Now, one of the other things that one can do with the exams is we could pick, in this case, a sequence. And I can go in and pick a customized sequence that I might have designed already. These are sort of cheat sheets. A lot of doctors do this. They might just have one for the neck pain and one for low back pain. And then it'll go in a particular order that the doctor wants. It's very easy, and I'll certainly show you if you decide to use EzNotes, but it works like that. So that is how EzNotes exams work.